Welcome to Bellingham Voices. I'm Marie Marchand. Today's show will be focused on mental health, and in particular, I have guests from NAMI Whatcom, and NAMI is the National Alliance on Mental Illness. First, I'd like to introduce Kim Sauter, and Kim is the education coordinator on staff, and she also volunteers to teach Family to Family, an evidence-based program, which we'll talk about during the show. And Laurie Maxwell is a volunteer in the office, and she facilitates peer-to-peer. She's also a board member, and she's a state trainer with NAMI Washington. Welcome to the show.
Thank you for having us here.
I'm really excited about this show because it's important to talk about mental health. We all know that as a society, there's a lot of stigma about it, and so it's just important to start the conversation, especially here locally, because that's where we live and that's where our families live. So I wanted to start out by asking you how you got connected with NAMI Whatcom. And would you like to start, Kim?
Yeah, I can go first. I have two family members, my kids that had to deal with mental illness at a young age, and we went through some really hard times in our family. Hard times finding out what was wrong with our kids and getting the right kind of help. And by the time we got to a certain point, I was really thinking I needed to do something positive. Just to help other people from the experiences we had had. So that's how I got involved.
Wonderful. Thank you.
And I became involved with NAMI because I live with a mental illness, and my health has improved enough that I wanted to give back to the community, and I thought one of the ways to do that is through NAMI. And then I learned so much about the programs that I just became really excited about being able to volunteer in all aspects of NAMI.
Mm-hmm. This is great. You're both very passionate, and I have the honor of working alongside both of you because I'm on the board as well of NAMI. So let's see. So Kim, I know you're not a brain scientist, so we'll start out by saying that.
That's true. Yep.
But you do teach the evidence-based program, and
Right.
you do interact with people who have mental health conditions
Yep.
directly. Mm-hmm. So I wanted to ask what the latest brain science is around mental illness. The brain, people say, is the most complex of our organs and the most difficult to learn about, but still there's advances going on every day.
Right. So one of the things we try to focus on in our class and our support groups is the idea that mental illnesses are medical illnesses that can be influenced by the environment. And that, that's kind of a general term saying we don't know exactly what's going on. Scientists are working on this. The brain is a hugely complex organ, and the brain is the organ affected when you have a mental illness. Just like if I have diabetes, my kidneys and my eyes, those organs are going to be affected. The deal with mental illnesses is that they seem to be really multifactorial. We know that there is some genetic component, especially in schizophrenia, which is probably one of the most highly studied of all the mental illnesses. We know that 1% of the people throughout the world, the population, will have schizophrenia. But we also know that families show some heritability. It's not a definite thing, but if someone has a first degree, a mother or father that has schizophrenia, they have probably a 10% chance of developing schizophrenia. But also, scientists have theories that maternal influences, such as viruses that mothers may have been exposed to, can influence this. Toxoplasmosis. And then, of course, other environmental influences such as stress, also using marijuana. A lot of scientists are thinking now other drugs, illicit drugs, or I should say marijuana is legal now, but there's some evidence that those things all influence the onset of schizophrenia.
Mm-hmm. And when mental illness is diagnosed and treated earlier, the kids have a better chance of it not being as severe. Is that right?
Yeah, that's my understanding. Like I said, we're just volunteers. We're not trained clinicians, but from all the evidence and what I've seen in my own family, it is very helpful to get a diagnosis, because then you can find out what the evidence-based treatments are. Though it's also very hard to get a diagnosis, and it sometimes takes a bit of time. It's not something that happens when you see a clinician one time. Usually they do not give you a diagnosis that quickly, because so many of the symptoms in mental illness are very fluid between the different illnesses. So.
Let's get an idea of the landscape of NAMI Whatcom, and this question's for both of you. There's maybe a misperception in the community, I'm not sure, you deal more directly with the community, that NAMI Whatcom helps people who are mostly having what's called serious mental illnesses, although I think any mental health condition can be serious. But they're talking about the schizophrenia, bipolar, and depression. But in reality, there's a wide spectrum of people that you walk alongside. Is that right?
Yes, and in one of our groups, we had someone who lives with attention deficit disorder who joined our group, and she was more than welcome. And it was a different, it was interesting to hear her perspective and hear how it was similar to what other people are going through, and to learn coping skills just like anyone else. So.
Yeah, I guess one of the things I'll say when somebody calls the office is that, everyone's experience, their perception is going to be different. And the one thing about our groups is that people will sometimes call and say, I have bipolar disorder. Do you have a special group for people that have bipolar disorder? And we always have to say, no, we're really sorry, we don't. But the fact of the matter is that all these mental health issues, there's certain things we all can do to live better lives. And it doesn't matter whether you have a slight depression or major depression. Some of the things that we all can do to live better lives, they're the same. It doesn't matter what your diagnosis happens to be.
Let's talk a little bit about the classes that you both facilitate. We'll start with you, Kim, about family to family. Can you tell us a little bit about that?
Well, Family to Family is a 12-session course. It's 2 hours a class, and we usually hold it in the evenings. Every evening we just do totally different things, but we talk about the brain, we talk about medications, we talk about how someone gets a diagnosis, we talk about, we have an empathy workshop, so loved ones can learn how to be more empathetic and understanding of what it might be like to live with a mental illness if they haven't experienced that themselves. We do communication, problem solving, and then we do a lot of focus on in NAMI, we talk about mental illnesses as being a traumatic experience, because they are, not only for the individual that has the illness, but also for people that support that person. It's very traumatic. And so we do spend a lot of time talking about how do family members, how do those of us that support someone with a mental illness, how do we take care of ourselves so we can advocate for them in a better fashion.
And what about peer-to-peer, Laurie?
Yes, I teach peer-to-peer, and it's for people who live with a mental illness or a mental health condition. They don't have to have a specific diagnosis, and it's for adults. And what we teach, it's very interactive. So we teach coping skills, we teach about the different illnesses there are, the major illnesses, and we also teach how to advocate for yourself, such as when a person's in the hospital, what to expect when going in the hospital. We also do a mindfulness activity every week, and that's one of my favorite things, because it's like relaxing even after dealing with stressful information, and teaching those coping skills that we talk about. It lasts 10 weeks, and 10 weeks. It lasts 2 hours. It's going to be on Thursday nights, starting September 14th for this fall. So.
How is that different from the Connections group that you also co-facilitate?
So Connections group, the Connections Recovery Support Group, that's the entire title, it's a support group led by people who live with mental illness, by peers. And so it meets year-round, and so the classes meet twice a year, and you have to register and all that. But the Connections Support Group is it's based on a recovery model where we focus on how to be able to, how to cope in a situation, how to, there's so much group wisdom among the people who attend. So we tap into that, and we talk about, well, what can we do when, it's wintertime in Bellingham and it's rained for 3 weeks. And so how can we make this a better time for ourselves when dealing with depression symptoms? And there's a lot of wisdom in that group. So it's welcome to anyone. All of our programs are free, and anyone is welcome to attend. An adult who lives with a mental illness is for the Connections group.
And you mentioned the word recovery, and a lot of people, I think, when they hear that, think of substance use disorder recovery. But there is the idea of recovery, and it's a resilience, and it's a rebounding, and oftentimes counselors say, well, you may not be able to live without your disease, but you can have episodes that are less intense and that are further apart. And I think that's part of recovery.
I think it's also, for me, is having a good quality of life. And so that's been one of the gifts that's come about in my life from, there's living with a mental illness. It is a struggle sometimes, but then a person learns how to grow and how to become resilient, and then you get to enjoy life, enjoy life much more. So I think of recovery as, it's like there was life before the mental illness, then I went through the acute phase, and then it's like slowly I've been coming out of that, and I've been able to volunteer a good bit in the community, and now I'm working, and I've been able to use my skills now again, and I'm very grateful for that. So that's what recovery means to me.
Thank you. So Kim, talk a little bit about the hope that you see and that you experience in your work and volunteering, that type of thing.
Well, we always try to keep up hope. I mean, that's one of the tenets of both of the family support group and the Connections Recovery group. That is one of our principles, is that you try to never give up hope. It can be difficult. We get very difficult calls, and a lot of folks call us when they're really in crisis. And it really is so much easier to keep up your hope when you're able to meet with people that have maybe not the exact same experience as you, but they've gone through similar experiences. Share those experiences, share that wisdom. That is one way you can, that can really help you keep up hope, because people do get better. They do learn to live with their symptoms much better than they do when they're first in crisis or when they first are developing the illnesses.
When somebody calls and they're in crisis, you don't act as counselors because that's not your background, that's not your education. So what do you do when somebody calls in crisis?
Well, we provide resources in the community. And if someone calls and says, I'm trying to find a counselor who takes my insurance. So we'll refer them to someone in the community, such as the Whatcom Alliance for Health Advancement, WAHA. Or if someone is talking about, what's some other examples for resource calls?
Well, just help. Help. Sometimes it's just empathizing. Somebody calls, my loved one is in jail, and I know they have a mental illness, but we don't know what's going on. What do we do? And we're so fortunate because we have members that we can, if I don't know the answer to the question, or I don't have that experience in my family, in my life, I can drum up somebody and give them a call or text them. And we always try to get back to people if we can't answer the question, exactly when they call. That's the beauty of it. None of us are experts, but we all have our different lived experiences, and some of them are often very common. It's great. It's wonderful when you hear somebody else has gone through that. It just is such it's a burden lifting, when you hear that someone else has had that same experience.
For instance, someone came to the office, their family is moving to the area, and they have an adult child who lives with a mental illness, and so I was able to share the community resources to that family, and they said it's like a burden lifted off of us, just knowing those resources.
We recently had the NAMI picnic, and that was great. It was a small group. Thanks to Kim, especially for all your work on that. It was a small group, but the people there were really important, and by important, I mean first-time connectors, and people who really needed to be connected. What do you see as the mental health services that are lacking in our community?
First off, I'd like to say that Whatcom County, compared to other counties, has some very good resources. I would say that we have resources such as counseling and psychiatry and those mental health services, but they're very stretched thin. We just don't have enough of the providers. So it depends also upon your insurance. If a person has Medicaid, such as that insurance, or Washington Apple Health, then they need to go to one of the clinics, and so it's their budgets are stretched thin, so people don't get to see a counselor, say, as many times as they need to, or they are limited to the number of psychiatric appointments that they can see. And so, such as me, I wanted to switch from seeing someone in the clinics to seeing someone in private practice. It took 7 months for me to be able to get an appointment with a psychiatrist. And I only found one in Whatcom County. So it takes a long time, and people need to be persistent in looking, because there are some excellent providers out there. It just takes time finding them.
Wow, 7 months.
Yeah.
That's a long time. And you're an adult. I know that for children, it can be over a year to just see a provider, no matter what insurance you have.
Right.
So that's one thing I've noticed is lacking is mental health for kids and young adults.
Yeah.
I wanted to talk a little bit about the board, and you and I are both on the board, and I know that we're looking for members, so we're going to try to sell this as much as we can. So on our board are people who have connections to mental health, because as you're talking about, Kim, NAMI Whatcom services aren't just for people with a mental health condition, it's for family members and friends, because so many people get affected. And so on our board are people with family and friends, and then there's people who are peers. I have a peer counseling certificate, and so does another member. Actually, before we talk about the board, talk a little bit about the peer counseling field that's emerged. When did it even start?
I think it's been in the last 10 years that this field has developed more fully. So it's called the Peer Support Specialist Program in the state of Washington. A person becomes certified in this field by taking a 40-hour course, and then, but it's difficult to get into the training. That's one of the things. So they're working on streamlining the program. It's through the state of Washington Division of Behavioral Health and Recovery Department. And so what's neat about this program is, as a peer, I can say stuff, I can address an issue that a provider could never. Like if a person's really struggling and going, I just cannot get up another day after living with such depression I'm going through. Well, I can say, I've been there, I've been through the same thing, this is what I did to get through that struggle. And so, and also I know as a peer, I can challenge a person who is saying something like, I tried this resource in town, I tried that resource. I can say, well, what about these resources or 3 more resources? Because I've been there trying to find, those services in town. So it's a great program. So such as Compass Health hires peer support specialists, peer counselors. And so they go out in the community, like with the CPIT team, and help with when a person's in crisis. There's also some other programs that hire peer support specialists too. And they're throughout the state of Washington, and it's a nationally known program also.
I really enjoyed the training because I learned a lot about empathy and compassion and the value of that, especially in the moment for people, helping them get through the crisis. You mentioned CPIT, and I just wanted to unpack that acronym. It's Crisis Prevention and Intervention Team, right? And people can call Volunteers of America when they're in a crisis, or 911 if they need to. But they can call Volunteers of America, and we'll get that number and put it on the screen, and they can be connected to CPIT. And that means that people come to you. So they would come to me in my home with 2 providers and a peer counselor.
Yes.
So that's great. So thank you for explaining that. I think it's a really exciting field. I think it's innovative, and what I've learned about it is that providers really value it. And that's kind of evolved a little bit. Maybe the providers were questioning at the beginning, right? And then it's kind of evolved to, wow, this is really effective.
Yeah.
So that's great. So back to the board.
Yes.
So I want to ask you about kind of the ideal board member from your perspective in terms of supporting our staff people, but also, we work with people and how our board's currently working, that type of thing.
Yeah, so for our board, I would say an ideal member of the board would be someone who is committed to wanting to make a difference within the mental health field and who's passionate or passionate about that field. It's usually someone who's been personally affected by mental illness in some way. And one thing we're looking for, one type of member for a board member is someone who is like a mental health provider, such as a clinician or a psychiatrist or a psychiatric nurse practitioner. That's just one field, or a provider in the general medical field. But we're really interested in anyone who is interested in making a commitment to help the community in the mental health field.
Wonderful. So some of the duties in addition to supporting staff would be shepherding the resources, human and financial, and also ensuring that the programs align with the mission. And every year at our retreat, we kind of look at the mission, and we're really just happy with the fact that we've added all people who are affected by mental illness. We recently did that. And I wanted to say that people can call the office if they're interested, and they can be guided about exploring. And that number is 360-671-4950. And they can go ahead and give us a call. And the process is filling out an application and having coffee with one of us, and then coming to a meeting and seeing if they like it, if we can connect. And Kim,
I would like to say, sometimes when people ask, what does NAMI do? I say NAMI provides support, education, advocacy, and research. The research is more on the national level, but we provide support groups, we provide education classes and education forums, and we advocate for people like when they call and with the resource line. And we also, we also have the stigma stomp, which you're going to discuss in just a little bit.
Oh, we can open that up right now. So tell us what the stigma stomp is.
Well, this year it's an almost 5K fun run because our course had to be adjusted a little bit. Out at the at Blodell and south of Lake Whatcom. I'm missing my words here.
Saturday.
It's Saturday, October 7th. And we're going to start at about 9. We're having a mental health fair. The mental health fair will open at 9. And we have a superhero theme because everyone needs a hero. And we hope that people will come out and maybe they'll get on a team. They'll form a team of 10 or more people and dress up and do the fun run or walk. Walking is always allowed. People often call and say, can you walk? Yes, we love walkers.
Good. And I missed the last organizing meeting, but I saw on the minutes that you do want me to wear a cape.
Yes.
Well, that's going to be a stretch for me.
Yes.
For NAMI, I will do it. So the stigma stomp, that's kind of a segue into how we're funded. The Whatcom County Health Department funds us generously. And then Peace Health, they give the building to us at no cost, and they have for many, many years. So the stigma stomp's an opportunity for ordinary people to get involved and find out what we're about, learn the resources at the mental health fair, and that helps our budget too.
We really depend on people joining us.
We talked about the board and the board's volunteers, and we're recruiting. Are you recruiting other volunteers for your programs, Kim?
Oh yeah, we're always looking for folks that want to come in the office and help out, answering phone calls, learning the resources, and if people really get excited about NAMI, we do send people to trainings. All of our folks that are running groups and teaching classes have all gone to a training and passed that training, and that's run at the state level. And so we send members off to trainings, and then we hope that they're going to volunteer their time with us. And we could not operate without volunteers. We only have, a one staff member or a couple of people that work as one staff member, and so everything else we do is run completely by volunteers that have put in the hours to go to the trainings, and yeah.
And you're two of those amazing volunteers, so thank you so much. Thanks for all you do for the community and for joining us today. And thank you for joining us for Bellingham Voices. We'll see you next time, and take care.